And here to talk to us about the Centaurus subvariant and monkeypox, we have OCTA Research Fellow Professor Guido David joining us via Zoom. Good evening, Professor David. Welcome to The Big Story.
Hi, good evening, Robbie and Sean.
Professor, it's something very basic. I mean, we have to think of, we can't recall anymore kung ilang subvariants na pinag-uusapan natin. Every time there is a new subvariant discovered or validated, what does it do to our data? Does it necessarily make it tougher for us to track everything?
Well, not necessarily kasi Robbie, they have similar characteristics naman as far as this Omicron subvariants are concerned. Maybe one is more transmissible than the other, but we will see that naman. If cases start to accelerate, then we will feel this transmissibility that we are talking about. And in fact, in a previous episode of The Chiefs, I think we talked about the possibility already of the Centaurus subvariant already being here in the Philippines, and true enough, the data confirmed this. We were concerned because the surge that we have right now is lasting longer than what we projected. It's right now, we're now 2 months into the wave and it's still not yet peaked. And one possible explanation is that there is a new subvariant in the country.
Okay, so given, sorry, but
just to ask about that peak, how come it has sort of, it's not that it's plateaued, but it's kind of like, smaller waves at the plateau. So what gives? Why is it doing that?
Yeah, very good question, Sean. And we were puzzled initially because we were modeling the wave, this current wave, from what happened in South Africa. And then in South Africa, it was just a 2-month wave. So 1 month up, 1 month down. So we were expecting something similar, but right now it's already about 2 months up. But it's a slow increase. It's not anything dramatic like what we saw in January. So what could be causing the delay? Well, we have some possible explanations. One is the presence of new subvariants. I mean, we have multiple subvariants. We have the BA5, BA4, we have the Centaurus now. We also have the BA2.12.1, and that may be causing a prolonged wave. The other one proposed by Father Nic, an OCTA fellow, is that it's the waning immunity that's causing the wave to be prolonged, because the immunity that wanes occurs at different times for different people. So maybe, next week my immunity is waning possibly, and then maybe another few weeks from now, maybe one of your immunity is waning. I mean, I'm just giving an example of how it may be causing a staggering of the infections to occur.
Given that, what does this do to your projections, let's say in the coming weeks, for the numbers of COVID cases in the country, regardless of subvariants?
Yeah, well, the projections are still, it's actually fairly spot on in terms of the numbers. We were projecting a weak surge, and we are seeing that. We're seeing 3,000 to 4,000 cases. We might even hit 5,000. I hope not. But we're not reaching the high levels that we saw back in January or even last year when we had 40,000 cases. Of course, that's partly because of the lower testing volume that we have now. So it hasn't changed the level of the projections. It's just changed the length of the project or the duration. And now we're seeing possibly that this wave could last until the Burr months, maybe until September or even October, if it progresses the way it's going right now.
All right, we also have monkeypox now, Dr. Guido. Have you started modeling for that new disease?
Yeah, actually, Sean, we're looking at the, how fast it's spreading in other countries. Like, for example, in the US, there are already 5,000 cases. I was also talking to Father Nic earlier, and we were discussing about, how, well, it's been spreading in certain communities in some countries. And, but we don't want to be complacent that, that's the only pathway. As the DOH OIC mentioned, anybody can get the monkeypox if they're not careful. And the concern, of course, is that, we have the index case now. We're not sure if there might be more cases. We're not saying there are. We're just saying that, there's still some level of uncertainty, because sometimes the symptoms may come out, a few weeks after contracting monkeypox. I mean, they might get fever and chills, but you might think it's just normal flu, and then after a week or two, they might get these rashes. That's characteristic of monkeypox. So that's a concern. But right now, we're closely monitoring if there's any developments, if there are additional cases. Hopefully not. It might not spread in the country, and that would be good. But there's a possibility that it would. Right now in Asia, in East Asia, Singapore has the most number of cases with 11. So it's still a relatively a much lower number compared to the numbers they're seeing in Europe and US.
Okay, OCTA Research Fellow Professor Guido David, maraming salamat po.